Welcome back, baby. Summer is here, and many of us are going to be laying by the pool. But whether you are by the pool these days or not, one thing that can happen is swimmer's ear. Do you know what swimmer's ear is? And do you know how to prevent it? Well, joining us now with some tips is Dr. Lana Joseph Ford. She's the founder and CEO of High Level Hearing, and she also does Healthy Habits with Dr. J here on Great Day, Louisiana. Hey, Dr. J.
Hey everybody. Hey Malik. Thanks for having me this morning.
Thanks for coming on the show. I can hear you just fine, audiologist. I
Um,
love that. As you know, I am really glad we're talking about swimmer's ear because I know swimmer's ear very well. For people who do not know what swimmer's ear is, what is it exactly and what are the causes?
yeah, sure. So swimmer's ear is actually a condition that we see pretty often, especially being an audiologist, where we'll have people who tend to swim a lot or kids who tend to get in the water and have, interestingly enough, different or underdeveloped shaped ears, end up getting water inside of them and it's really hard to get out. So it results in some type of ear infection. We call it otitis externa. You call it swimmer's ear.
And it's more than just being by the pool, right? You can also get it maybe if you're digging too deep with a Q-tip or something like that, correct?
So it actually is caused mostly by the pool, by water. But to which your point, what you were saying, if you have some type of hole or perforation inside of your ear, and you do get into your ear, it can result in causing swimmer's ear that way as well. Mhm.
Fascinating. And it's a bacteria that gets in your ear?
Yes, exactly. A bacteria will get in your ear, it'll form some type of mucus, or it might have results of drainage, ear drainage. You might have redness, itchiness in the ears. It's just not a good thing that happens often to swimmers and kids.
Did you
Mhm.
heard some of the symptoms, redness? If you have that, you may have swimmer's ear. How do you, as an audiologist, diagnose swimmer's ear?
So, as an audiologist, I don't necessarily diagnose swimmer's ear as much, but I do see it. We usually leave it to the primary care physicians to tell the patients, hey, you've got some drainage, it's likely swim here, go ahead and get antibiotics and they'll treat it with it. They'll treat it with antibiotics that way. But what I do mostly is I help out with the prevention component of it. And that's when it comes into making sure that our patients are wearing earplugs and protecting their ears before anything even happens.
I know that's one of the biggest treatment options, getting earplugs. You're taking a video of earplugs that you actually made for one of your coworkers, Alicia. You do earplugs at high level hearing?
Yes, we do. In our office, we do earplugs all the time. I've been known to do earplugs myself for probably like hundreds of people here in the city, but also for celebrities. A lot of times people are often, they'll ask me about my experience with Drake, but yeah, with those swimmers earplugs, they are they're the way to go.
Okay, you cannot name drop Drake and not have me ask you about that. You make earplugs for Drake?
Well, actually, yes. So it's a different type of earplug. It's actually a custom plug for musicians, which is very common in people here in New Orleans. They use them all the time. In fact, one of the other musicians, local singers, local artist Denicia is one of the clients that I've worked with before, taking the bangers as well. And yes, celebrities, musicians, artists, they need these plugs to protect their ears.
She is a busy woman. Now, for swimmer's ear, I am wondering if you get swimmer's ear, is it something you always live with, or is it something that goes away but then can come back?
That's a great question. It actually, thankfully, can go away as long as you're utilizing antibiotics and the appropriate treatment and the appropriate prevention measures. Then you shouldn't have to worry about swimmer's ear again. Just make sure that you're protecting your ears at all times.
And there's more tips right there. Make sure you swim wisely, keep those ears dry, and of course, avoid those foreign objects in your ear. We're talking to the kids out there. Well, hey, Dr. J, thank you so much for joining us, my beautiful friend, looking good as always. And hey, if you want more information about swimmer's ear or high level speech and hearing center, go to the website highlevelhearingnola.com. There are also two locations, one in New Orleans on Magnolia Street and one in pair a hand. The addresses are on your screen. And of course, you can always give them a call at 504 345 2980.